Within the amniotic fluid, the baby savors a soup with hundreds of ingredients, all with different smells and tastes.
Lorsque l'enfant passe,
when the baby passes from her amniotic fluid bubble into air, she takes with her this memory of prenatal smells and uses it after birth in her interactions with her mother, such as to position herself against the mother's body and to drink the maternal milk.
Birth is now only days away, with full term being defined as any time between 38 and 42 weeks. In fact, research shows that only 5% of babies are born on their due date. At full term, when the fetus's lungs are finally ready to pass from water to air, they secrete a great quantity of proteins called surfactant. The fetus, in regurgitating this chemical cocktail, activates the maternal macrophage, a type of white blood cell, in the amniotic fluid. The macrophage penetrates the uterine wall, creating an inflammation, which provokes the first contractions. Dr. Carol Mendelsohn explains this timeline.
Basically, the timing of birth is decided by the fetus. So maturity of the lungs at the time of birth is essential for the fetus to make the transition from an aquatic to an air-breathing environment. During development and late in development, the fetal lungs begin to make surfactant, which is a fatty substance that enables the little air sacs in the lung to remain expanded and prevents them from collapsing.
Sometimes a baby is in no hurry to see the outside world. Dr. Mendelsohn believes that the fetus always has a good reason, in particular immature lungs. But when there finally is a big increase in protein released from a fetus's lungs, contractions begin. It won't be long now. Finally, the big day has arrived. The baby is born. A new life enters the world.
With the first cry, the baby's respiratory system is activated, and this is followed by a shunting of blood toward the lungs so that increased amounts of oxygenated blood can be carried to all tissues of the body. In the following hours, the digestive system is activated.
The acidity of the stomach and the secretions delivered by the liver and the pancreas break down the large food proteins into smaller molecules that the newborn's intestine is able to absorb. With the arrival of the first germs, the intestinal flora help to fight them off. Gradually, the baby's kidneys become more efficient. And a few days after birth, the immune system emerges. The lymphocytes, small white blood cells, patrol the blood vessels and eliminate harmful bacteria. After just a few weeks in the outside world, the newborn has already developed strong visual and olfactory preferences. The baby is naturally attracted to the odor of its mother, but also to the smell of its father. It is said that the family has an olfactory signature. This signature is also recognized by the mother and father, who are able to identify the specific odor of their offspring. Dr. Alan Slater of the University of Exeter has devised an experiment to demonstrate that babies are also endowed with an innate sense of beauty.
We're going to show your baby pictures of faces and see if they prefer to look at some rather than others.
Dr. Slater has shown more than 100 newborns different types of faces. In all cases, babies spent more time looking at the faces considered more beautiful based on adult standards.
Jackie, change the pictures. Newborn babies, even when they're just a few hours old, are particularly attracted to faces, and particularly to attractive faces, because attractive faces most closely approximate the proportions of the golden section that we know that babies and adults find attractive. The golden section is a ratio or a set of proportions that dates back to ancient Greek times that acts as an aesthetic marker for judging the beauty and pleasingness of various objects because it represents symmetry and harmony and perfect proportions between the features of objects.